188 children of age 8 will have autism spectrum disorder. Today I will discuss what Asperger's syndrome is, the medications, and the research done since Asperger's syndrome was discovered. All in all, I would like to give a better understanding of what Asperger's syndrome is and how you can help those who have it. So let's talk about what Asperger's syndrome is to help you better your knowledge on the disorder. Autism disorder of neural development characterized by impaired social interaction, verbal and nonverbal communication, and restricted, repetitive, or stereotyped behavior. Asperger's syndrome is the closest when it comes to autism, part of the 5 processive developmental disorders. Asperger's syndrome is a developmental disorder that affects a person's ability to socialize and communicate effectively with others. Children with Asperger's syndrome typically exhibit social awkwardness and an all-absorbing interest in specific topics. Some of the symptoms of Asperger's syndrome include problems with social skills. With this, you have a lack of eye contact, few facial expressions, or awkward body postures and gestures. Another symptom will be eccentric or repetitive behaviors, sometimes including obsessing over baseball statistics or weather, or sometimes obsessing over different kinds of snakes. You have unusual preoccupations or unusual subjects that they'll be obsessed with, and they also have communication difficulties, like hard time reading people or understanding humor or sarcasm. They have limited range of interest. They can only stay on one topic or subject at a time, and they also have coordination problems, which moving clumsily or with poor coordination in general. Some of the ways you can help diagnose Asperger's syndrome is by having a physical and neurological exam, and these will be done by doctors or people who study in this field. You can have comprehensive assessment, which is neurological and genetic with in-depth cognitive and language testing. You will have intellect and academic abilities, IQ tests. How can children and parents live with Asperger's syndrome? Living with Asperger's syndrome, the main thing you have to have is patience. You have to learn what the child needs and become an expert on your child. You have to teach them to understand themselves and appreciate who they are. You have to be prepared with your responses to a difficult behavior or cycle that will calm the situation so you can react from your plan and not from emotions. Be patient with your child and yourself and prioritize what to focus on first. Some of the treatments when it comes to children with Asperger's syndrome is one of the things is you can have on special education, which is based on when they have public schools. When they're in schooling, they have special classes, or you have special teachers who come to your home. They have behavior modifications, such as coping problems with behaviors, such as interrupting or obsessions, meltdowns, or angry outbursts. We have speech, physical, or occupational therapy. For speech therapy, you can help with pragmatics of a give and take of a normal conversation. You have physical therapy, will help with motor coordination, and you have occupational therapy that will support sensory interrogation. You also have social skills therapy. This will help them be more effective with the interpersonal reactions and interactions. They can speak in a more natural rhythm, as well as how to interpret communications. Techniques such as gestures, eye contact, tone of voice, humor, and sarcasm. And with Asperger's syndrome, there is really no medication out there that can treat it, but the use of drugs to help treat specific symptoms, such as anxiety, depression, hyperactivity, and obsessive compulsive disorder. One of the ways that you can help children with Asperger's syndrome, they have the U.S. College Autism Project. And with this is a group of colleges that comes together to help raise money to more research and help find medication that can help the children. You have conferences that are around the country that can help explain to parents and people who have Asperger's syndrome and how they can help better themselves and other ways that they can teach other people. And you have educational training for people who want to do special education and plus for people at home. And My Autism Team, which is a social network for parents who have autism or autism-like disorders. And for support, you have a daily strength website, and this website is not only for Asperger's syndrome, But for any mental or physical disorder, people can post on the site with questions or just helping or just to give a daily log of how their life, like how the day was. You have the Global and Regional Asperger's Syndrome Partnership, or for short GRASS. It's basically a foundation to help those with Asperger's syndrome. And you also have Facebook and social networks where they can create pages and blogs for people who have Asperger's syndrome to help them out. And finally, let's look at many ways that you can help those who suffer from Asperger's syndrome. In conclusion, by the end you have received the proper know-how to what Asperger's syndrome is, the treatments, and also how to help live with it on a daily basis. The individuals, from children to adults that have Asperger's syndrome, still need help to spread the word. We need to realize just because they have some mental impairment does not mean they cannot have a normal lifestyle. With the proper knowledge, we can educate those who have Asperger's syndrome and others who can help them deal with it.